Hello, my name is Debbie Sullivan, and I am the grandparent of a 5-year-old grandson who has autism. He was a really good baby. I remember when my grandson was 10 months old that his babbling and cooing stopped. I didn't think too much of it at the time. I thought it was normal that every child reached developmental milestones differently and that he would soon start talking. He had crawled early on and was already walking by 11 months, so I wasn't concerned. After he turned 1, he still wasn't talking, and I thought it was strange and started to notice that he wouldn't turn his head to us when we called his name. I just knew it was his hearing and had his hearing tested. It was extremely hard to get a hearing test on him because he didn't want anyone to touch his ears. The test later showed there was no concerns. Around 18 months, we had a developmental screening done, which showed delays in language, and he qualified for early intervention. He continued with speech services, and when he was 3 years old, we had a more in-depth evaluation done at the Children's Hospital. Where he was diagnosed with autism. I remember that day clearly. It was hard for my family to come to terms with this diagnosis. No matter how well we were prepared about worrying so much about my grandson's development, hearing that he has autism was devastating. This was not what I imagined for my grandson. I was entering something entirely new and unknown. I was scared. Over the last 2 years, I have accepted this diagnosis and the changes that living with autism brings. My grandson brings so much joy, not only to his family, but those he has contact with daily. On behalf of Wyoming Family to Family Health Information Center, a collaboration between Wyoming Institute for Disabilities and Uplift, we are here to bring you the presentation, Autism Spectrum Disorder, Symptoms and Recommendations. This is an important topic for parents. If you know that you are not, to let you know that you're not alone, and the importance of seeking other resources in early intervention if you discover that your child may have any of these signs or symptoms that come with autism. Here today with me to talk about autism spectrum disorder, symptoms and recommendations is Dr. Doug Scambler.
Hi, I'm Dr. Doug Scambler. I am a clinical psychologist and I practice here in Wyoming. I got my graduate degree in clinical psychology at the University of Kentucky and went on to do a postdoc at the University of Colorado Health Sciences Center. And that was followed by 5 years of being a professor at Oklahoma State University before coming here to Wyoming to practice clinical psychology. And I really enjoy my work with families and children, and I'm really excited to talk about autism spectrum disorders today with Debbie. We, through conversation, came up with some ideas for the presentation, and this should be just thought of as a kind of an introduction to the idea of autism, and there are many other places to get additional information that you'll have access to if you follow the references on the WIND website. But we want to talk about what's the idea that families might ask, what makes you think my child has an autism spectrum disorder? And what can we do about helping my child with the autism spectrum disorder? And these ideas came through discussion that Debbie and I had. And so we'll kind of start by talking about the diagnostic criteria that have been used for autism spectrum disorder for the last 10 years or a little bit longer than 10 years. And then we'll talk a little bit about changes that have been made in the last year because the American Psychiatric Association has published a new version of our diagnostic criteria for autism spectrum disorders. So we'll talk a little bit about that. But the way that we have thought about autism spectrum disorders is to think about 3 areas of impairment or 3 areas of problems that children have. The first is communication, and it's not only the use of words, but it's the ability to express your needs and wants. and also to understand what other people are asking of you. So it's verbal communication and it's nonverbal communication too. And then, so that kind of goes hand in hand with the second category, which is social interactions. And for children who have an autism spectrum diagnosis, they also sometimes have difficulty understanding when someone is trying to interact with them, or figuring out how to get someone's attention to have a social interaction with that person. And then the third area that we look for if we're trying to figure out if an autism spectrum disorder describes what's going on for a child is to look at their patterns of behavior. So some children with autism will do some repetitive play. They'll play with their toys in only this one way, or they'll categorize their toys instead of playing with them in a pretend play way. Other children with autism will get stuck in routines, and if you try and change their routine, they get very upset about that. And I hope what you hear me saying here is that there's not one thing that we're looking for that says, this child has an autism spectrum disorder, but there are a number of different symptoms that we're looking at, and if children have difficulty in these three different areas of social interaction, communication, and patterns of behavior, that's when we start to wonder about whether an autism spectrum disorder will describe their concerns.
Do they have to have an impairment in all three areas?
That's a great question, and before the last year, I would have had one answer for you, and I'll talk about that first because the terms that we'll use are familiar to people. So the old way of diagnosing an autism spectrum disorder was to decide whether a person had autistic disorder, Asperger's disorder, or PDD-NOS, which is pervasive developmental disorder, not otherwise specified. And the diagnostic criteria for autistic disorder include difficulties in all three of those areas. You need to have symptoms of social difficulties, symptoms of communication problems, and then also either restricted areas of interest or rigid adherence to a certain pattern of behavior. And for that diagnosis of autistic disorder, the signs needed to be present before 3 years of age. So for a diagnosis of Asperger's disorder, you needed to have concerns in the area of social interactions and restricted behaviors or repetitive patterns of behavior. But you did not need to have a symptom of a communication disorder. And the thing that really limited the use of this diagnostic category is that you couldn't have any early language delay. If you had an early language delay, then you didn't qualify for an Asperger's syndrome disorder. And you couldn't show any delays in cognitive development or in self-help skills. So your measured cognitive ability had to be at least in the average range, and you had to have adaptive skills that were at the same level as your peers. So that's two of the diagnostic categories. And then the third category is pervasive developmental disorder not otherwise specified. And that often referred to kids who had a milder form of an autism spectrum disorder, even though that's not really reflected in the name. But for this diagnosis, you need to have at least one symptom in the social domain and at least one symptom from either the communication or the restricted areas of interest and repetitive behavior domain. And you can't meet criteria for autistic disorder or Asperger's disorder. Otherwise, you would have gotten those diagnoses would have applied. So that's the way we have been talking about autism spectrum disorders for the last over 10 years. The changes that we have this year with the publishing of the DSM-5, which is the Diagnostic and Statistical Manual of Psychiatric Disorders, the 5th edition. The criteria have changed so that we have one autism spectrum disorder. The symptoms in the communication domain and the social domain are combined, and so you need to only show symptoms in either of those domains to meet the criteria for the diagnosis. And then the repetitive behaviors and restricted areas of interest is a separate area of concern. And the thing that's been added to the diagnosis is that is a symptom of hypo or hyper reactiveness to or responsivity to your sensory experiences. So now it's required that kids have either a visual or auditory or olfactory reaction to their environment that's different than their peers have. Okay. So the new criteria indicate that symptoms need to be present in early childhood, but they don't have to be they don't have to reach the level of a diagnosis before 3 years of age. And there needs to be a clear impairment or limitation related to the symptoms. So if you have a kid who's just kind of odd or quirky, but they still do everything they need to do, and it doesn't seem to impair their social interactions or their participation in school, then they wouldn't qualify for the diagnosis. We're really interested in helping kids out who they're having trouble getting along in their environment. And then another addition with the new criteria is that the severity of the need in the area of social communication and in the area of restricted and repetitive behaviors are considered differently. So we rate the kids' needs on a scale of 1 to 3 in the area of social and communication needs, and 1 to 3 in the area of restricted areas of interest or rigid adherence to certain behavior patterns. And so those are the kind of behaviors that we look for in kids in order to decide, does an autism spectrum disorder describe the concerns that your child has? One addition that I think is important for folks in Wyoming is the diagnosis for or the educational category of autism spectrum disorder is slightly different than the medical diagnosis. So in addition to the symptoms of social and communication impairment and the restricted areas of interest and repetitive behaviors, the school category indicates that there needs to be some obvious cognitive difference. So the individual has to have difficulty with concrete versus abstract thinking, awareness, judgment, and or the ability to generalize. And they need to or they need to show a cognitive difference in their perseverative thinking. So if they have a really highly focused interest that they keep coming back to, is that interfering with their participation in school? Or they may have a difficulty with processing symbolic information. And examples of that would be some kids with autism spectrum disorder might have difficulty understanding that a cartoon drawing of a school bus represents an actual school bus. So that abstract or symbolic representation of the school bus is sometimes difficult for them. All right. So we talked about how the diagnostic manual divides up the symptoms. But I think if you're a family member and you're worried about what's going on with your young child, another way to think about the symptoms of autism is to think about things that are missing that you would expect from your child. So the things that are missing for kids who get an autism spectrum diagnosis are that they do limited social referencing. And social referencing is checking in with your social partner. So if I'm a little kid and I'm with my mom and a stranger enters the room, the first thing that a typically developing child will do is look at their mom and kind of see how she's reacting to that stranger entering the room. And for a lot of kids with an autism spectrum disorder, they notice that the stranger's coming into the room, but they don't rely on their mom or their dad or their important person to decide whether they should, how they should react to this stranger. The other thing that's missing that you would expect to see for young kids is communication attempts. So even before kids have language, they're pointing and grunting and taking you by the shirt and dragging you over to something to have you look at it or get help with something. And for kids on the autism spectrum, we see less of that communication early in development. And then you might also see a lack of expression of emotion, and especially in a shared way. So young kids will get a new toy or build something that's interesting, and they'll look at it and they'll smile at it. And typically developing kids will smile at their toy, and then they'll find their mom and they'll smile at their mom. Like even before they have language, you understand that they're saying, "Can you believe how cool this is? This thing is the best." And for kids with autism, sometimes they'll get excited about that toy and they'll smile at it, and you can just tell they're excited about it, but they don't do that expected thing, which is to turn to their important person and say, "Check this out. This is great." So those are things that you would expect to see that you might not see if your child was had an autism spectrum disorder.
Those are some of the things that I've seen with my grandson. However, he is now starting to show some of those. So he's able to communicate more with us, and he looks to us for with his, for us to give advice on things to him. So
good, that's great. And
I know that when he started doing that, our family was just really excited.
Yeah,
that,
you noticed that
we
he
see
was
progress for him. So
sharing and for a lot of kids that they need a little extra exposure to those opportunities. And I mean, from what we've talked about, you guys have provided that extra opportunity for your grandson. It's almost like we have to turn up the volume on all of these social and communication things that we
I think
want
that's really
the
important
kids to develop. Yeah. So, when we talk about ideas for supporting your child with autism spectrum disorder, I'm not going to talk about a prescription or this is the way you have to do it, but it's things like turning up the volume on your social interaction with your child, or giving them a lot of opportunities to communicate by pointing to things to make choices.
And that was something that we didn't know from the beginning, but through the services that we received, they've given us a lot of ideas. When we went to Children's Hospital, they told us to at least have 20 to 25 hours of extra services, which was like speech or occupational therapy. And we have tried to provide as much as we can for him, and we have seen a lot of progress with him in his development. So.
Good. Yep. And so, and you guys, you're a family in Wyoming here, so can you kind of give us an idea of how you've managed to get those services for your grandson first?
It wasn't really easy because a lot of the services aren't offered here in Wyoming. He is on an IEP, and so he receives services through the developmental preschool.
Okay.
And the University of Wyoming does offer some services. We have the speech and hearing, so they work with him a couple days a week. And then the hospital offers some speech language. They don't offer any more OT or PT at the moment for children. So we have looked to Children's Hospital in Denver, who has helped us find other resources for him.
Good. So it sounds like you have to be a little bit creative about how you get those services.
If it's not here, I mean, there are other places that you can find the information and they can provide it to you. So there are resources out there.
And then I think the other part of it, too, is that your family is providing intervention. When you listen to what the speech-language pathologist says, and then you implement
And everyone in the family knows, and everyone tries to follow that. So we're seeing more language with him. He's 5 right now, and his language is very limited. But we have key words or key things that we do with our hands. If we do like this, that means he knows he needs to say 3 words, and it's usually I want and to play and whatever he wants. So he is speaking to us. So it just needs to give him a little push there.
Good.
So.
And that reminds me of another thing that we talked about, which is the consistency across people and across environments.
Right, that is very important.
Really
in the beginning,
important.
we weren't all consistent, and he didn't have the structure, and we've seen him really struggling. Over the last couple of years, we've had, he's been very consistent and structured for him, and he is really, I mean, to see him 2 years ago and to see him now, I mean, it's a huge difference with him. So we're really pleased.
Good. Great. Okay. So, and then, the other part of being a family member and kind of trying to figure out what's going on with your child might be to look for things that are there that are unexpected. And for children with an autism spectrum disorder, sometimes that's unusual movements like hand flapping or pacing in a circle. Sometimes it's unusual toy play, like lining up their toys. Some kids will line up their toys, and if you try and interfere with their play, they become very upset about that.
That was something that early on they said that our grandson flapped his hands a little bit, and when they mentioned it, I could see it, but before that, I really didn't. It wasn't a big deal to me. It wasn't something to, make note of. So.
All right. And then as children get older and they develop language, you might hear them talking about the same topic frequently. So they sometimes show an intense focus on a specific interest. And for some reason, for a lot of kids, it's Thomas the Tank Train. I don't know if that's true for your grandson, but...
I think it's the iPad.
The iPad.
The iPad.
Okay.
You can't get away from the iPad, and that's just...
Okay.
So there's a lot of things
there's an
in...
intense interest there.
Very intense.
iPad. Okay. And then the other thing that you might see that's unexpected is an unusual or a unique use of language. So sometimes kids will engage in repetitive speech. They'll say a word or a phrase that's in their favorite Disney movie, or they'll request milk by using some word that they've made up, and they always use that same word to request milk.
When he wants juice, he will say orange.
Okay.
So that we know that's what he says he wants.
Okay. Yeah. Okay, and the things that you might see that might change over early development for children with the autism spectrum disorder is that before preschool age, you might see that kids are pretty strict about their routines, and they get upset if you try and brush their teeth before you put their pajamas on, or switch up any kind of little routine like that. You might see them playing with their toys in a rigid way, like the lining up of the toys. And you might see less expression of repetitive behaviors. So you might see less of the hand flapping and less of the pacing. But then at preschool age and older, those repetitive behaviors sometimes increase for kids with an autism spectrum disorder. And you sometimes become more aware of their really focused interests. And I think part of that is that as they develop language, then you get to hear what they've been thinking about all the time. So those are some things that might change over early development. We, as a field of mental health, have developed some reliable tools for diagnosing autism by 2 to 3 years of age. And that's something that has developed pretty quickly over the last 10, 15 years. But we know that signs of an autism spectrum disorder are present throughout the lifespan. When folks look at a group of children who have autism spectrum disorders and they look to the future for those kids, they track them over 5 and 10 and 15 years, they find that early language skills often result in more positive outcomes for those kids, and early intervention is really important for helping kids develop age-appropriate skills. So figuring out when they reach kindergarten that they need to sit in their chair while their teacher's talking, and look at their classmate when the classmate is talking. Those skills are things that early intervention really helps with. All right, so you asked about what causes autism, and we have some pretty good information that there's a significant genetic component to autism. The reason that we think that is that if you look at the prevalence rates for autism spectrum disorder in the general population, you see that there are about 1 in every 68 children who have the diagnosis of an autism spectrum disorder. If you have one child with an autism spectrum disorder, there's a 3 to 5% chance that you'll have another child with an autism spectrum disorder. So that's a pretty significant increase in prevalence. And then if you look at identical twins, so twins who share all their genetic information, and you have one child with an autism spectrum disorder, there's a 60% chance or greater that that second twin will have an autism spectrum disorder. If you look at non-identical twins, so twins who share the same genetic information as their siblings do, that rate drops back down to the sibling rate of about 3 to 5% prevalence in the second twin if you have one twin with a autism spectrum disorder. And when I just talked about the prevalence rates in the general population at 1 in 68, that's a new prevalence rate that was just released here in 2014, and that's a 30% increase over the rate that was reported in 2012. And we think that based on these prevalence rates, it looks like about 5 times more boys have the disorder or the diagnosis when compared to their siblings. Not their siblings, when compared with girls. So 5 times more boys than girls get the autism spectrum disorder diagnosis. And this is a much higher rate than we've previously thought for an autism spectrum disorder. And partly what we think is going on is that the clinicians are getting better at using the diagnostic instruments that we have. So kids who didn't receive a diagnosis before are now receiving it. And I think this is important because if we have an accurate understanding of what's going on with a child, we can really figure out how to support them in the best way possible and really help them maximize outcome. So I guess in terms of causes of autism, the things that I think are important is that it's a highly genetic disorder. There's some environmental factor that impacts the expression of an autism spectrum disorder, but we don't know exactly what that is. And when people have looked into this idea that immunizations cause autism, there's not support for that idea. The original data that had everyone excited about that possibility was fabricated. So the scientists lied about the information that he had. And so as a field, we've been trying to kind of correct that mistake for a long time. But we think that this increase in prevalence is really about the field getting better at trying to support kids who have different development rather than something related to immunization. And so, one of the things we talked a little bit about is, so why is it important what causes an autism spectrum disorder? And, it's not important in terms of trying to figure out who to blame, because we know that it's not parent behavior that causes autism. We know that it's something that's biological, and whether mom brought it to the table or dad brought it to the table, there's nothing we can do about that once we have a child. And the reason that it's important for us as a field to figure out what causes autism spectrum disorders, from my perspective, is that I think that we can develop more effective interventions if we know about causes. We can work towards earlier identification so that we can get early intervention in place. And we can provide more complete information to families and care providers. And then there's also this possibility that at some point we could figure out a cure or a better way of addressing the symptoms of the diagnosis. But we don't have a cure now. We have some really good interventions that improve outcome for kids, but we have not gotten to the point where we're talking about cures. All right. So when families have a child with an autism spectrum disorder, there's a tendency to think about all of the child's concerns in terms of, well, they're doing that because they have an autism spectrum disorder. But we're learning a little bit more about other concerns that seem to show up more in children who have an autism spectrum disorder. So anxiety is something that often occurs, and we have some ideas about how to help kids with their anxiety. And depression is something that sometimes shows up a little bit later in development, like in the adolescent years for children with autism spectrum disorders, and it shows up at a higher rate than it does in the general population. There are attention problems associated with autism spectrum disorders. Sometimes they're different than the kinds of attention problems that you see for ADHD.
Right.
So you might see the child with autism get overly focused on their interest and not be able to shift their attention to what the teacher wants them to wants them to pay attention to. So shifting attention is sometimes a big problem for kids with autism. And then there's a higher prevalence of seizure disorders for children with autism spectrum disorders too. And we talked about how do you support children with autism spectrum disorders, and I think we need to look at the behaviors that are creating difficulty for them, and then also the behaviors that are strengths for them. We need to look at their communication, their social interaction, and their understanding of social experiences. And then also think about, autism doesn't describe a person. It describes a set of symptoms that affect people. Children with autism also have their unique personalities.
Right.
And sometimes sometimes aspects of their unique personality create difficulty for them. Sometimes those are really strong assets for them too, and we want to look at individual differences when we're trying to figure out how to support the individual with an autism spectrum disorder. And regardless of the approach that you take for supporting kids with autism spectrum disorders, one of the things that society will ask you to do, I think, is to modify negative behavior. So if they have trouble with screaming in the middle of class or running away from you, I mean, those are things that we have to try and figure out how to support kids quickly with those things. So
that was something that we noticed with my grandson, that the negative behavior was when he wanted something and he couldn't tell us what it was, then we would see this, fit.
Okay.
But it was something that by giving him the communication board and he was able to at least tell us what he wanted, then it helped with that.
That's great. And you guys did a functional behavior analysis. Did you know that?
No, I didn't.
You did. So you looked at his behavior that was creating a problem, and you said, well, when does this behavior happen? It happens when he wants something and he can't tell us.
Right.
So, you did things like you changed the environment by giving him this board that helps him communicate. You taught him what you wanted to see. You taught him, if you want juice, you say orange, or you point to this picture of juice.
Right.
You do these other things besides, other than screaming and throwing a fit. So you broke it down, and then you provided some supports at these different levels.
It also gave him a schedule. The communication board, we were able to do a schedule for him, and so he always knew what was coming up next, so that he knew what the routine was going to be. So there wasn't.
Yeah. And so for another 5-year-old, you might communicate the routine by saying, hey, we're going to have gym class and then a snack, and then we'll play out on the playground. And for some children with autism, you need to do that communication in a different way,
right.
like through the board, the
right.
visual schedule.
Yeah.
So that's great that you guys have figured out those things. So you changed the environment by giving him the board. You taught him what you needed him to do that's more appropriate than screaming. The more appropriate thing is to point to juice. And you rewarded that appropriate behavior by giving him juice or
right.
whatever it was
mm-hmm.
he was requesting. So that and then the other part of it is changing the consequence. So when he screams, he no longer gets juice, but when he uses his board to point to juice, he gets juice, right?
Mm-hmm.
Okay. And the things that I think are really important for changing outcomes for kids are to have appropriate expectations for them. Then that's something that needs to be constantly adjusted. You talked about how much growth you've seen for your grandson in the last couple of years. So an appropriate expectation for him 2 years ago, he can do that without a problem.
Right.
Now
right.
you have to raise the bar for him to get him moving in the right direction.
Right. We no longer use a communication board for him, so.
Good. You expect
him to
verbal?
Mm-hmm.
Okay.
But we give him help.
All right.
But
yeah, so you're moving the expectations forward, but also keeping them at an appropriate level.
Right.
So he doesn't have to tell you a full sentence with inflection or anything like that.
Right.
But that might happen in the future, right? And then, so having appropriate expectations is appropriate or is important. And then you talked about you help him with his verbal communication. So you're shaping the behavior that you want to see. He doesn't have to say orange juice. He just has to say orange.
Right.
And then next year he'll have to say orange juice.
Right. Mm-hmm.
And you, the other way to help kids with their skills is to use mistakes as teaching opportunities. At some point when he says orange, you might hand him an orange. And
right.
then he'll say, well, I don't want an orange, I want orange juice. And so then you can work on that next skill through, a mistake in his communication.
And these weren't things that I knew, I just knew to do. It was through help with the developmental center and the early intervention and through the speech and hearing clinic here. So
good. And then when you're really working on building those new skills, providing clear and easy opportunities for the child to use the skill a lot is a great way to really get the skill established.
That's really important, I think.
Yeah. One of the questions that we talked about was what can I expect for my child in his daily life, and I think what might we expect in the future for a child with an autism spectrum disorder? And that's a really hard question to answer. We think that early intervention changes outcomes for kids quite a bit. And there's some good research that says that we can change their developmental quotient by 20 points. So that means that they could go from a level of, cognitive development that's below the average range up into the average range with the appropriate supports. So, I don't know what the future holds for a specific child. When we look at groups of individuals who have autism spectrum disorders, and we look at what they do as they get older and into adulthood, we see that people with autism spectrum disorders gain communication skills, they grow in their social interaction abilities, they expand their areas of interest, and develop the ability to kind of control their repetitive behaviors, but they still often, a lot of the time, they have difficulty doing the expected behaviors that are expected for that age. And when you're thinking about what kind of job will my child with an autism spectrum disorder have, or where might they work, where might they live, I think, again, you want to consider the individual strengths and needs for the person that you're talking about, and then also look at the job opportunities and different environments that they could possibly have access to. So, you know, in our community, there are a number of different levels of supported living that people can access. So you can live in a group home with 24-hour supervision. You could have an individual apartment where someone checks in on you a couple times a day, or you could have even more independent living arrangement. And so there's some options, and you're going to want to look at your child's strengths and needs when you try and figure that out. And then in terms of jobs, I think taking that functional behavior approach and really analyzing what kind of supports do we need to put in place in order to help this individual transition into the job and stay in the job. I think that's really important. And then in terms of specific ideas for supports for individuals with autism spectrum disorders, both in adulthood and in childhood, there's an approach called social stories.
Right.
Is your grandson
Mm-hmm.
using some of those?
Yeah.
Okay. And that is a way of describing a social situation and trying to use the perspective of the person with the autism spectrum disorder. So if you don't have an autism spectrum disorder, you might walk into a social situation and figure out pretty quickly what's going on and you know, how people are feeling and what's expected of you in that situation. But for a person with an autism spectrum disorder, some of that information about other people's perspectives, about what's expected of you in that situation, need to be spelled out pretty clearly.
Mm-hmm. And they usually do it with the child's picture in it so that they can relate to them.
Okay.
So
nice. And then scripts are also helpful for some people with autism spectrum disorder. So really role-playing and kind of scripting out what might be expected of you in a social situation is important. There's some new ideas about modeling, video modeling the behavior that you want to see. And I think that's a powerful tool because you can have a narrator, so you can have the verbal information about what's expected, but then the person with autism also gets the visual information too. Here's someone playing with barn animals. You know, the cow goes over and eats some hay, and kind of gets a visual of here's what you might do with these different toys.
That's something I'll have to try.
All right. And then there's some new ideas about peer mentoring too, especially as kids get a little bit older. And that could be done in a group setting or in, a child with autism spectrum disorder and a peer and an adult mentor to kind of give the child with an autism spectrum disorder maybe a safer person to work on skills with. Okay. And I guess another thing that we talked about was how you have used some tools to organize your grandson's experiences so he knows what to expect and what's expected of him. And we talked about visual schedules and calendars. As kids get older and young adults and adults might take advantage of software on smartphones to really schedule out their days, or provide them with reminders when they reach a certain location. Remember to talk to Miss Miller about the English assignment that I don't understand. And that reminder would pop up on their phone as they walk into English class. Some things like that seem to be helpful for older individuals with the autism spectrum disorder. You might find that you have to review schedules with individuals with the autism spectrum disorder more regularly than you would with their peers. And let them know in advance if you're going to change your routine.
Yeah, I think that's really important.
Yeah. And that I think most families figure that out pretty quickly, that
We
they
did.
need to provide a reminder or a heads up for kids about changes in routine. So I think that's some ideas for organization. And then in terms of communication, and I have these are some ideas to support adults, but they're also important for younger individuals with the autism spectrum disorder. But the things to keep in mind is that the typical nonverbal communication that you use to let someone know what you're thinking or what you expect from them might not register for the person with the autism spectrum disorder. So, and I think this is frustrating for a lot of teachers, because for 15 out of 16 of their kids, they can kind of stand over their desk and give them a stern look, and 15 out of 16 kids know, oh, the teacher's not happy with what I'm doing right now, and I need to change my behavior. But the person with autism spectrum disorder, that type of communication might not register for them.
Right.
So that might just be like it's raining outside and the teacher's standing over my desk, and it doesn't really provide them with the information that they need. And then, so the other side of that is that the person with an autism spectrum disorder might not give us the nonverbal communication that we expect. So, I've worked with adults who, kind of have a pretty flat affect on their face, and they'll say that they're really working on their nonverbal communication. And I think, well, I don't see a whole lot of change in your facial expression, or I don't see you using gestures to communicate, but that message is not getting across the way that we expect it. And for that person, maybe it was that they're not doing unusual things with their hands. They're keeping their hands still, whereas before maybe they would, engage in some repetitive behavior that interfered with nonverbal communication. So, so the things that are oftentimes important for us when we're trying to help kids understand what we're talking about is to speak in a direct and clear manner, and not use figurative speech. And figurative speech is something like saying, you notice someone's wearing pants that are too short for them, and you say, "Hey, when's the flood coming?" To kind of indicate that their pants are too short. That kind of communication is difficult for a lot of individuals with the autism spectrum disorder. And then provide plenty of time for the individual to respond to your communication. So that's something we expect people to kind of be right with us and respond quickly when we ask a question or make a request. Either I'm going to do it or I'm not going to do it. But for kids and all ages of individuals with autism spectrum disorders, it sometimes takes them a little bit longer to process. What is the request that you made? How could I go about responding to that request? Yeah, maybe I think I could maybe do that. And so then, maybe 15, 30 seconds have passed before they start to do what you ask them to do. And that can be confusing or bothersome to people who don't understand what's going on for the person with the autism spectrum disorder. And we talked about using visual supports, spoken word, written. You know, as kids get older, you want to write down your communication, and then also model what you expect from people with autism spectrum disorder. So then we have a couple of slides of references for the information provided in the presentation, and then some other websites that have useful information too.
Well, thank you for joining me and Dr. Doug Scambler today. For information and materials on autism spectrum disorder and other health care topics for children with special health care needs, please visit the Wyoming Family to Family Health Information Center website at www.uwyo.edu/wind/F2F. Thank you.